The final step is reading the result. The Vista IQ result is a probability of malignancy, a screening signal, not a diagnosis. It supports your clinical judgment. It does not replace it. Vista IQ is powered by heat diffusion imaging, HDI. The scanner emits a brief, controlled pulse of blue light, and a built-in thermal camera measures how the tissue responds. Benign and malignant tissues produce distinct thermal signatures because they differ in density, metabolism, and vascular structure. An AI system, trained and validated against cytology and histopathology from a large clinical data set, analyses those signatures and produces two outputs: a cancer risk level for every scan, and, where confidence is high, a tumor-specific diagnostic finding. Each scan returns one of three cancer risk levels: low, approximately 2% probability of malignancy, with a negative predictive value of 98%. Moderate, approximately 25%. High, approximately 50%. Both moderate and high sit above the 10% threshold at which sampling is recommended. About 1 in 5 scans returns an additional diagnostic finding, a specific tumor type the AI can identify with high confidence. These findings only appear when the system reaches at least 90% specificity for that tumor type. Among low-risk masses, the system can identify lipoma, benign epithelial tumors, or sebaceous adenoma. Among high-risk masses, the system can identify mast cell tumor. Together, the cancer risk level and any diagnostic finding give you a clearer next step. Results land in the app within about a minute, and a PDF report is emailed to your chosen address at the same time. The dashboard shows the cancer risk level, any diagnostic finding, the recommendation, the thermal image, and the location of every mass on the patient's body. Low risk means monitoring. The recommendation is to track the mass over time and rescan if it changes. Roughly 2 in every 100 low results may still harbor malignancy. So if clinical signs raise concern despite a low result, investigate further. For moderate, further investigation is highly recommended. For high, further investigation is required. Most flagged masses will be confirmed. Some will come back benign. That is not a false positive. That is the screening doing its job, surfacing the question and helping you resolve it. Set client expectations before the scan. A higher risk result means further diagnostics, and a benign sample is a good outcome. When discussing results with owners, anchor on what the screening found, what the next step is, and why. A simple frame. The screening flagged this as worth checking. We checked. Here is what we found, and here is what we do next. That positions you, the vet, as the decision maker, with the screening as one piece of evidence.